welcome back to the show. Food allergies are a growing food safety as well as a public health concern affecting an estimated 8% of children in the United States. Now that's 1 in 13 children, or about 2 students per classroom. Now, with many schools opening their doors in the upcoming weeks, our next guest is giving us some tips to help guide you through any possible food allergies your child may have. Now, joining us to share more, we've got a pediatric allergist and immunologist and assistant professor of pediatrics at Mount Sinai Kravis Children's Hospital, Dr. Roxanne Oriel. And Dr. Roxanne, thank you so much for being with us.
Thank you so much for having me this morning.
And as we talk about, kids are going back to school, and the one thing that parents are always on guard for are the issue of food allergies. But as I said in the lead, they're becoming a little bit more and more prevalent as we see in our school system.
Yes, indeed they are. And studies have shown that we maybe experienced an increase in the past decade. And so this is a problem that we need to face head on. And it's important that parents and children who are relatives of those that have food allergies be prepared. One of the first things to think about is whether or not your child actually has a food allergy. So a lot of people do think that they have food allergies and they may not. So seeing an allergist who is experienced at diagnosing, managing, and coaching on how to treat is very important, because you don't want to have avoidances of foods unnecessarily.
Yeah. So when we talk about food allergies, how does a parent know whether or not a child is actually in that place of food allergies? What are some of the common symptoms that we may see?
Sure. So if a child were to eat a food and within 2 hours, typically more immediate, within minutes, the child experiences redness, itching, hives, which is a rash that leads to a raised area, lip swelling, difficulty breathing, severe belly pain, vomiting, any one of those symptoms immediately after ingesting a highly allergenic food should prompt questioning about an allergic reaction and a food allergy. So if your child has experienced something like that, then it's best to see a specialist who is able to determine whether or not this is truly an allergy or if it's something else. But yeah, I mean, we at Kravis Children see a lot of patients who are avoiding foods unnecessarily. And so I think one of the major things is, does your child actually indeed have a food allergy, or were they told to avoid because of positive testing? And so very important that an experienced allergist determines that. So diagnosis is very important.
We hear a lot about peanut allergies. That's the number one that we always hear a lot about. But are there any other food allergies that are more prevalent that we see in our children?
Sure. So yes, everybody is very aware, hyper aware of peanut allergic individuals, so much so that there's an FDA approved treatment for peanut allergic individuals now. But what people may not know is that tree nut allergy is starting to increase in prevalence, and tree nuts include foods like cashews, pistachios, walnuts, and pecan. Sesame is another one that other families may not realize could be an allergy. Fish, shellfish, dairy, eggs, wheat, soy, all of those are top allergens.
And so for a parent that says, okay, I know my child has a food allergy and they're sending their child to school, what's the best possible thing for that parent in approaching the school and letting them know about that food allergy, and what should they be doing?
So one of the really important things to do is to ensure that your child has an emergency action plan to provide to the school. That emergency action plan details the symptoms that should prompt medication and which medication to administer. So for example, mild symptoms like a little bit of itching or a couple of hives around the mouth should prompt use of an oral antihistamine, such as diphenhydramine or cetirizine. Severe symptoms, head to toe hives, vomiting, difficulty breathing, repetitive cough, just not looking right, any one of those should prompt epinephrine use. And so one of the major things that we counsel on is ensuring that patients bring their emergency action plan to the school so that the school is permitted to treat their child should they have an allergic reaction, and also so that everyone's on the same page. Okay, this is how you treat an allergic reaction if symptoms are mild. This is how you treat it if the symptoms are severe. So that's step one. Step two is ensuring that there are medications available should there be a problem at school. So how does the school manage allergic reactions if this were to occur? Do they have stock epinephrine, meaning one that's not assigned to specific children, but if there was an allergic reaction that were to occur, it's ready? Do they have oral antihistamines at the ready? Do they have a school nurse? So all of these things are issues that should be discussed with the school prior to the start of the school year so that it's a seamless transition. Parents don't have to worry because everyone is on the same page.
Are we finding that more and more schools are actually prepared for children with food allergies as the numbers continue to rise? I've heard from some parents that sometimes schools don't even have an adequate plan to be able to deal, but are we seeing more and more awareness and ability to be able to treat these students as they come through doors?
Yes, so we are seeing an increased stability of managing food allergies just because there's a rise in this condition. If your school is not equipped to treat an allergic reaction, you can advocate, hey, this is how to treat an allergic reaction. This is how you would treat my child, show them, instruct them on how to use the auto injector. But most schools now have some sort of plan in place to treat. There is somebody, maybe only one, but somebody on campus that has been trained to use these medications and trained to identify symptoms. Is every school like this? No, unfortunately. But I think over time it will be something that, I hope would be required. The CDC does have voluntary guidelines on how to manage food allergies that were put out years ago. It's voluntary, but it's there for schools to refer to should they have questions on how to manage this appropriately.
Yeah. What are some of the common mistakes that we're finding amongst parents as they're dealing with their children when it comes to food allergies? Are there any things that stick out to mind as some of the most prevalent things that parents do that they really shouldn't do?
Yes, so sometimes parents don't bring the medications with them everywhere that the child goes. So let's say, take for example, when a patient comes to my office and they don't have their epinephrine auto injector, and I say, well, what happens if your child accidentally ate something or picked up a snack and had an allergic reaction on the cab ride over here? So one of the most common mistakes is not carrying the emergency medications wherever you go. Yes, your child may not have a plan to eat anything, but what if they accidentally ate something? It's almost like a life insurance policy. Yes, you may never need to use it, but you have it just in case of a problem. So that's one thing. Carrying your auto injector, carrying your oral antihistamine, just in case there's an allergic reaction, even if you don't plan to eat, that's very important. Another one is avoiding the food if you were told that your child's allergic. I have some patients and their families who experiment, especially adolescents. Adolescents are the higher risk group. They take chances and they will try a little bit to see if they'll have a reaction, or sometimes they just want to fit in with their peers. So that's another thing that could be problematic, is experimentation with eating the food that they're deemed allergic to.
Very important information there. Thank you so much for being with us. And we want our viewers to know now, if you want more information or you have any questions, please visit the website, mountsinai.org. And also, don't hesitate to call at 212-241-5548. Dr. Roxanne Oriel, thank you so much for being with us.
Thank you so much for having me. Have a wonderful day, everyone.
All righty. You have a wonderful day, too. And we want you to continue having a wonderful day with us here on Open. That's why we encourage you, don't go anywhere. Taking a quick break, but Open returns right after this.